Doyin Ogunbi. Again, we're proud of what your institution is doing. We know you coming in from a private sector point of view, listening to some of the things that, Dr. Jaffet just shared. Again, the question still remains same, and you can actually share your insight with regards to that. In your opinion, as a returnee, as a citizen right now rendering services, what are your genuine opinion on the current state of our sector, of the healthcare sector in Nigeria, and of course the region you might be also operating in, with regards to challenges, opportunities, and regulations? Dr. Doyin.
Thank you. Again, an honor to be on this panel, an honor to be on with these fellow guests who are very knowledgeable. It's wonderful to hear Dr. Ilbute Olusin's thoughts, interesting perspective as a returnee diasporan, and I think I share with her. The notion that this is the proudest work of my life, being able to return to Nigeria, and I share with her and all our guests, and of course our experts, including, and of course primary healthcare, which is the most important, the most fundamental aspect of our healthcare. That Dr. Olubogi has enunciated. We all have identified some very important and critical aspects to healthcare in Nigeria, and one of them, of course, is financing. The money is the fuel, it's a very, very critical commodity that we need to not just build the infrastructure, but maybe even more critically to maintain the infrastructure, to train our workers, and to retrain them and continue to train them to keep the equipment up. There is no healthcare organization in Nigeria, even maybe a well-appointed private one. I'm privileged to be at a nice facility. Dr. Olusi has built an excellent facility there, but to maintain it, it takes money. Most of the healthcare is paid for in cash and private pay. Of course, we have the HMOs are represented on this panel, and they do an important job. But in general, we need more robust source of funding in healthcare in Nigeria. Of course, the government needs to do its part. The government in particular needs to concentrate on public health, on primary health care, making sure that those primary health care facilities are well equipped, adequately well built, and to maintain them, of course. And that, of course, needs good funding. And then the other thing that government really needs to do is to establish good minimum standards and to enforce good minimum standards to be practiced by everybody, both in public and private, and to hold all medical practitioners to account, hold us up to high standards. And so I think those are the areas that the government needs to help out most. If the healthcare funding can be more robust in Nigeria, because government has its part to play, but private insurance really, I would call for private insurance to provide robust health insurance products that will allow at least the middle class to be able to purchase decent health insurance and to be able to pay for good health care in Nigeria. Increasingly, we have excellent facilities in Nigeria, such as Dr. Olusi's facility, and I would say mine as well, and several others, especially in the big cities. But it takes money. Patients, it can be, even though it costs less, of course, for patients to stay in the country and come to our facilities. We are reversing medical tourism. Dr. Olusi is doing that. Duchess is doing that, and other facilities are doing that. And yes, it costs less to come to our facilities, but it still can can add up, especially if somebody's very, very ill, especially if somebody's in intensive care units. Oncology, cancer care is not cheap. Even though again, Dr. Lucy can provide better value that they can get in going to Britain or to US or even to India, but still it adds up. So if people could have robust health insurance, that'll help them to pay for good health care in Nigeria. So those will be the main points I would like to attend at this point. Thank you very much.
Thank you, Dr. Ogunbi. Just as Ubi said, you hit the nail on the head straight up with it. And I like the way you actually balance that out because, again, the role capital plays in all of this, sometimes we think is just come in and actually build a facility. But I love your emphasis on maintenance, on skill development, retraining the trainers, so to say, and also, coming in from the medical insurance point of view, because again, we are fortunate to be out here in the diaspora, and we know what's really driving out here is not just because people are able to pay directly out of pocket, but it's really that balance of medical insurance that gives people that privilege to be able to tap into the solid infrastructure that is out here. So I'm really glad that you nailed that in, and I'm also excited because the next